of today. And again, unless Elizabeth's crystal ball is better than mine is gone and blink from last year as far as what's going to be happening and what's coming down, because it seems like every time we think we know something, it changes. But we've tried to have everything up to date as of today. Meet our speakers here. This is Elizabeth Burrows, that'll be our only speaker for the day. I've known Elizabeth for a long time. I've been sending business her way for, she's been in business now for 7 years. It seems like I've been sending her business for 7 years, and everybody loves her. So she does a great job with, if you got anything FQHC, anything grant, she is your go-to person. I know she's, I guess, Elizabeth, are you still in Greene County, Indiana?
I'm not now. I did some interim work there, but I live in Vermilion County, Indiana, right by my dad's farm. So if you know that's right.
I was going to say, I see the cows in the background there, the farm. Okay.
Yeah. Yeah.
Wonderful. Well, I think I know I've been to Greene County so many times with Litton and Dr. Ridge's practice there. God rest his soul. That was. And here's your trivia question for everybody. Phil Harris is from Lyndon, Indiana. Lytton, Indiana. Who is Phil Harris? I didn't really have any appreciation of that until my child started watching The Jungle Book like 700 times, and I'm like, oh, that's Phil Harris. Okay, so without further ado, which wasn't a whole lot of ado, but Elizabeth, I will turn this over to you, make you the presenter. And let me see here. You've got a bunch of these on here. I'm gonna try the last one. I don't know why there's 9 of you showing up here, but I'm gonna click that over. Did you get that? Nope.
No, sir.
No. Okay. Let me see here. Well, let me go back. Yeah. For some reason, we're showing like 8 or 9 of you. View in full screen. Make another attendee presenter. Let me go up. I'll go one at a time.
Yeah, we're in business.
Oh, you're doing that? Okay, good. Okay, good. Are you sure you want to? Yes. Yes. Okay. There you go. Now you should be on there.
Okay. I think it's coming here.
Yeah. For some reason, it's gone back to.
Yeah, I know. Mine did too. So you may have to do that again. So as we get started, as Mark's working through a couple technical difficulties, of course, when we tested this, it worked perfectly. I just want to say this is a good lesson for all of us. Whenever we're ready to submit a grant, you think that you have everything ready, and then something will go wrong with grants.gov or one of the SAM or something. So I just want you to be aware that always to be ready for that. Oh, we lost it again.
Yeah, I don't know why it's doing that. Request denied. It keeps on. I keep trying to send it to you, and I tell you what. Why don't we we're gonna have to let me see if I can. I have no idea
Maybe
why.
You can pull it up. So this is just, but really it is a good lesson. If there's a technical difficulty that can happen, especially if this is one of the first grants you've ever submitted, I guarantee it will happen. And even though I think I have probably submitted over 1,000 grants in my life since I wrote my first grant at 18 to the Bill Gates Foundation and was awarded and became addicted. And at that point in time, I didn't realize the Gates Foundation was such a big deal, but it sounds great now. I just want you to know that that was the first time that we got internet and computers in the libraries here in my home county of Vermilion County. So there's how I became addicted to grants story. But I do want you to know if something can go wrong, it will go wrong when you're trying to submit grants.gov.
Oh, okay. Can everybody, I'll just, Elizabeth, if you'll just tell me when to move the slides along. Can everybody see my slides at this point? Danny, can you see it? I mean, see her slides?
I can see her slides. I don't know who's got control. It shows she does, but I can see them.
Okay. Yeah. Well, I can't see them, but we'll talk through them. So let me figure out how I can see them here.
Agenda for right now, we're on the agenda for the day. I don't know.
Perfect. I can see them now. So we're going to review the grant basics. We'll discuss the grant requirements for this specific grant, learn some grant writing basics and insight from a very experienced grant writer, and then understand grant budget and requirements. And I know a couple of you reached out to me prior about grant budgets. If we have time at the end, we will look at the SF 424 to make sure that everybody understands how to fill it out. But again, the nice thing about the SF424, it does check for errors while you're doing it. Okay, so the grant highlights. First, you have to submit through grants.gov. I'm not going to go through all the speeches. I think HRSA and NARC, the National Association of Rural Health Clinics, has done a great job in helping you know how to get registered. So make sure not only that you yourself are registered, but the entity is registered and that there's an eBiz point of contact and someone's able to open workspaces in grants.gov. So there's a few steps to that. So it's very easy for you yourself to sign up on grants.gov. It becomes a little more difficult to connect yourself to your organization. So make sure that's done. Again, $50,000 per certified RHC site. The grant is due June 23rd. You should try to submit early if you can. No matching funds. Here's the grant period is July 1, though they're not going to get your awards out until mid-July, they have said. If you don't know what NOFO,
hey Elizabeth, can I break in one thing? Nathan Baugh frantically called me about, I don't know, about 5 minutes before I talked to you, and he was worried that the message that I was giving was that you were going to get $50,000 as a minimum,
right.
Even though that's what when you listen to Lindsay and HRSA talk, it's pretty much what you said. But Nathan was very concerned that if we have more than, if every RHC applied, there's 4,600 of us, that would be about 21 grand per RHC. So Nathan just wanted to say, probably not going to happen, very low chance, but there is a possibility that you could possibly get less than 50,000. So he wanted me to say that. So
possibly get more. So yeah, but we'll talk about that. But thank you for that clarification. If you don't know what NOFO is, they talk about it on HRSA like we all should know. It's Notice of Funding Opportunity. Read it, highlight it, reread it, and check it before you submit. That is what HRSA goes by. If you have extra time, sign up on orhp.hrsa.gov to be a grant reviewer. You can learn a lot, but every grant review goes under, and it's all based off of the NOFO. Your grant requirements, these are the three things kind of that you have to have besides your narrative and your budget. A project abstract, this one's very easy. Only provide information requested. So again, it's like, you're in a deposition, just answer yes or no. Only provide the information requested in the abstract. Keep it very basic. You have to have your proof of eligibility. Don't try to get fancy here. Just use HRSA's proof of eligibility file. That's what they want. They have created that for you. And that's all on the RHC Vax Confidence page. You have to have your name, your address, all the, your street number, your zip code, your county, your EIN, and your RHC CCN. I know, make sure you have all those, make sure they are correct. I've already been working with a couple of you. One of you, somehow your DUNS number wasn't connected to the right address, those types of things. So make sure all of that is correct in order to, and that all needs to match up. Check it 100 times, have someone else check it, because you have to have the right tax ID number, your EIN, and your right RHC CCN. If you have not already worked at an entity that has an established indirect cost rate, do not start now. Don't worry about it now. This is not a grant to get an indirect cost rate. If you work for a university, if you're owned by a state entity, a county entity, or an organization that has filed an indirect cost rate that HRSA has previously accepted, you can use it. But otherwise, I would completely ignore attachment 2 if I were you and not worry about it on this grant. In looking at the project narrative, the first section is your methodology. And the first part, description of how you propose to increase vaccine confidence in the community. So that is a must. You must be working to increase vaccine confidence. Now, how you do that, don't get hung up on, oh no, I have to start a sign campaign for vaccine. That's the only thing I can do. There are pages in the back of the grant guidance that give you ideas, or again, just simply by increasing access to healthcare and having availability of vaccines with a partner or through yourself. Those are the things that will meet those requirements. So again, it can be health education, health outreach, it can be signs, it can be campaigns, it can be enhanced healthcare, primary care services, and just keep doing those services that you're already doing. The next element is something that I have seen very rarely in grants. I've had them come back later and ask us to redo a budget to accept more money, but very seldom have I seen a federal agency put, would you be interested in increased funding? This goes back, I think, to the comment that Mark made at the beginning of the webinar, not knowing how many rural health clinics will in fact apply for this funding. So the question is, will you accept more money? And you can look and use the exact statement that's in the notice of funding opportunity, and the HRSA call said the same thing, to use that statement and make sure you do say that I would accept more money and here's how I would use it. Again, make sure that it follows those back to the point of increasing vaccine confidence in your community. Use headers, so put methodology, use the exact same headers that HRSA uses in the NOFO, and make sure that you address every element that they ask of you. You don't want to give them a lot more information, but you do need to cover every single element. The work plan, this is the fun part. Appendix A, work plan template. It's on your NOFO, pages 18 to 20. And it tells you exactly what you need to address. What is the activity that you're going to do? They give you examples. Honestly, I suggest, and any client that I'm writing this for, I'm going to tell you to use one of their activities. They have set forth the activities they want. I would suggest using it. If you're dead set that you really need to do an activity outside of their ideas, please make sure it is very close to one of their ideas. I would totally stick with what they suggest, and then again, that $50,000 or that $25,000 or that $75,000 that you're awarded can then be used for that activity that they want, and you can use then your other funds, your normal third-party payer funds and money coming through your RHC to do the other activity that you're wanting to do. Do not think of construction, that's not allowable. But again, what activity you're going to do, describe that and the timeline. Make sure it's accomplished, that it can be accomplished by June 30th of 2022. And again, I know I've said it before, but I'm going to re-emphasize, I would use one of HRSA's sample activities on pages 18 to 20. And looking at your project narrative, another section is your organizational information. Who will be responsible for managing the award? And that is your project director. If your project director is currently not paid by a grant, it might be your RHC medical director, it might be your executive director, it might be someone that is at your hospital if you're a provider-based RHC. Whoever is, in fact, you're going to be the project director that is going on the HRSA award, ideally they would not be paid by other grants if their salary is being put into the budget, and it probably will be in some capacity. Make sure if they are being paid by other grants that it's not more than a 1.0 FTE. In other words, you can't be getting grants more than what their salary is. And make sure you have information on every RHC, which is your attachment 1 that we talked about before. But all of that counts in the points toward your organizational information. If you have questions about who should be the project director, you're always welcome to reach out to me. But again, it should be someone in a leadership position. It does not have to be a physician, but it can be a physician, but it should be whoever is quote unquote the boss, and ideally someone that has an upper level degree. HRSA does like to see that and often ask that when on the grants.gov forms about your project director. That person's name will then be on the notice of award, and they will be expected to be the oversight for this award. This is just some general grant writing tips. Make sure you write out your story. So why do you need the money? Why do you need money for vaccine confidence? Why does your RHC deserve money in general? Because again, this is a big time for RHCs to be able to even access grant money. So this is your time to tell your story. State your elevator pitch in your grant. So what if I was just asking you about your RHC, what are the 2 sentences that you would say to me? How would you describe that? Make sure you get your elevator pitch. When you write your story, or when you're writing your project description, your methodology, that's pretty much your story. Make sure you have someone who knows nothing about it read it and ask you questions, and then reread it with an open mind, because sometimes we know our facility so well, and we use, even with this, it's RHC Vax Confidence is what they call it. Well, if you just didn't know anything about this grant, how would you even know what that stands for? So, think about it. Sometimes we use medical jargon or we use RHC all the time. Well, the general public doesn't know that. So make sure that anyone could understand that. And again, do you answer the question, what will you accomplish through this grant? So in looking at your table of your list of your RHCs with your budget, with your narrative, are you explaining, does everything align? What are you going to accomplish with this? And even your abstract, the short little statement we talked about that goes into your grant, that needs to support that as well. So that is telling Congress, it's telling HRSA, and it's telling yourself, what are you going to accomplish? Because again, whatever you say in these grants, you will be held to do. So in writing the proposal, you want to make sure you write an answer to every section. You will repeat yourself, you will repeat yourself, you will repeat yourself on these. That's just how it goes. You end up having to put in your RHC addresses multiple times. You have to put them on the Excel sheet. You have to put them on the SF424. It's typing the same thing. I get that, but you have to do it. Make sure the budget matches the narrative. I have literally read and been a reviewer for HRSA numerous times, and I've seen where they're asking for money for things that aren't even mentioned in the narrative. So if you're talking about doing, health education outreach activities, and then, your budget says that you're going to pay that for, that you're going to use that for a doctor's salary, that may not make sense. It might make sense to pay for a community health worker salary, Facebook ads, and other outreach activities to your patients. Make sure the narrative follows the application or grant guidance, and it should follow the grant guidance exactly. Again, just provide the information they want, but make sure you address every part. Then check over the NOFO or have someone else check over it to ensure every element is included. And even those of us that are really experienced, sometimes you can overlook a bullet point or something. It's happened to me even recently, as many times as I think I check over these things. And I missed one little bullet point addressing a question. So just make sure you check over everything and have someone else check over it. The budget, complete your SF424. There's two parts of it. There's the general SF424 and then the SF424A. Those have to match up. So however you're categorizing your budget, personnel, fringe, other supplies, etc., those have to match up. No fund shall be used to pay the salary in excess of $199,000. So you have to reduce the salary. If you have questions about that, I'm not going to go into the details. You can look on HRSA's website and they have information about that. Grants.gov also has information, or you can reach out to me individually if you have specific questions, if the person whose salary you're paying is in excess of $199,000. Include indirect costs if you only have them approved. And for this grant, the total should be $50,000 per site, though again, that award is not guaranteed, but that is what they're asking for. So if you have 4 sites, your budget should be for $200,000. Budget narrative, only use allowable categories. They go through this in detail on the NOFO, the last 2 pages of the NOFO, pages 21 and 22. You can use it for personnel, for fringe benefits, travel costs, and those are usually billed at the federal rates. So pay attention to that. Equipment, which means one item is more than $5,000, and I'm just telling you as a side note, there's a lot of rules with buying equipment. In other words, you have to track that for future times in advance. So again, if I were writing your grant, I tell people I would use it for personnel or fringe or maybe some supplies, but or contractual services, which may also be similar to personnel or people working. But I'm just telling you, I usually tell my clients, you don't want to have to track equipment for years out. I'm dealing with closing a grant that has issues with it, and I'm learning the hard way. I wish I would have wrote their grants for them and not included some of the things they did, because it's very difficult. People include equipment and you have to track it again and submit regular reports to the government. So I would use it for personnel, fringe benefits, or supplies. Supplies is anything less than $5,000 per unit. So if you need computers, telehealth equipment, anything like that, that the unit is less than $5,000, that is fine. It doesn't matter if, let's say you need a new exam bed, $4,000, that's fine. It doesn't matter if you're buying 2 and together they're $8,000. It's how much each individual item costs. And again, you can actually request reimbursement for allowable activities retroactive to March 15th of 2021. So if you can show you've bought things or spent money, you can do that. If I were writing it, I would just keep it simple and write it from July 1 to June 30th, unless you have clear receipts and clear payment tracking mechanisms to show how you spent that money. Again, if you receive CARES Act, PPP, or other relief funds, make sure you explain how this will supplement and align, but not duplicate those activities. So you can't do the exact same thing you did. Make sure this is in addition to, or a new service, a new way to expand, or it will supplement what you've done. If it is something that, again, you would have to quit doing because you lack funds, that's allowable as well. Make sure you complete the SF 424 budget forms completely. That you do have to fill in every asterisk form. Sometimes that means putting a 0 in there. So if you're not going to ask for any equipment funds, you have to have a 0 in that box, or it will show an error. And all it says is an error. It doesn't tell you how to fix it. Make sure you review the grant against your guidance and instructions. I know I've said that before, but I will say it again and again. Again, it's just like when your child's applying for, or when you yourself apply to colleges or for scholarships, you have to follow every bit of the instructions. Know how you're going to submit. Make sure you have all your usernames and passwords. This just happened to me 2 weeks ago. The person that I was submitting for, the only person available, went on vacation, was out of the country. I couldn't believe an organization that employs over 500 people only had one person available to submit the grant in grants.gov. But that was the case. And so literally the organization had to get in her email, had to redo her password. It was a nightmare in the final hour. We don't want to deal with that stress. So make sure you have that available. Have someone within your organization proofread it. Have someone who knows nothing about your project or organization proofread your grant. And you yourself proofread it. Make sure every item is addressed. There are little things like with zip codes in the grants.gov world, your zip code is always 9 digits. So you have to make sure you can go to the postalservice.gov to look that up, but make sure you know your 9-digit zip code. Just little tricks like that that are different, and make sure that they're right every single time. Good luck. This is a really exciting time for rural health clinics. I am here. You can reach out to me at any time out here on the farm in Indiana. So my email is the best way to get a hold of me. I do have a cell phone. I soon will have a website, but I've gotten business by word of mouth and I don't even have an online presence. I have a LinkedIn page. You can find me, and that is it. But definitely by the end of this year, I will be having additional resources. And probably once I have those, I'll make sure Mark can share them on his Facebook page. I want to thank Mark and his team for giving me time. So at this point, Mark, it's up to you. We can either go through the SF 424 or we can answer questions.
Why don't you go ahead and go through that, because I know you had some people that were interested in it. So why don't you go through that, and then Danny and I will start culling through these questions here. So go ahead.
Perfect.
Can you do that? I guess is the question. Oh, there we go.
Can you see that? Is everybody looking at the SF 424 form? Okay. Perfect.
Yeah, it worked.
So, great. Yay, we're on a roll now. So yeah. Again, grant program or activity, that's going to be your RHC, VAX, confidence. You can put in the number. I think it will work when you don't put it in. This is a saved PDF of an actual grants.gov form. Your estimated unobligated funds are going to be blank, so you can leave those blank. It should not come up with an error. If it does, you can put in zeros, but you do not. You're not working. This is a brand new grant, so there's no way you have unobligated funds. For your new budget, you'll want to put in the federal amount you're requesting, which is $50,000 per RHC site that you have. So again, if you have 2 sites, you'd be requesting $100,000 is what would be put in here. Non-federal would be 0. There are no matching funds with this grant. That should be all you have to fill in on that page. Okay, the next page, you should only be filling in the furthest column, the furthest left column, column 1. That is however you want to spend money. So if, let's say you want to spend $30,000 in personnel, $10,000 in fringe, and $10,000 in supplies, that's what you would put. The other ones would all have zeros. For program income, you also should put 0. That is not being considered in this grant. Can you generate, if you're paying part of a doctor's salary, a nurse's salary, you're paying an MA to do vaccines, is that something you can generate revenue off of? Yes, but it's not something that has to be reported. If program income has to be reported in the grant, it will be listed in the notice of funding opportunity. Non-federal resources, these are all going to be zeros. I would not include anything, even if you're getting state money to do this or whatever, just make sure it's not for the same program, but you should not report it. You don't want to report any funds. All they're wanting is how you're spending this $50,000 per site. You can look and see how much money. I usually tell people over the 4 quarters, I would take $50,000 and divide it by 4. So there you go. I have $12,500 in each quarter. But if you think at the beginning you're going to draw down more, you can do that. You can put 25 and then divide it 10, 10, and 5. However you think you can draw it down, that's fine. There should be nothing in future funding period years because this is a 1-year grant. So that is a short version of how to fill out that form. And now I will pull up the other SF424 form for you. Is that up now, Mark? Can you see it?
I can see, yeah, yes, it is.
Okay, perfect. So on this, the first number 1, it's an application and it's new. You just mark those. If they don't have a big highlight on them, leave them blank. Don't worry about it. Ignore it. Don't stress yourself. Legal name, make sure you put your legal name of the organization. So for example, if you are ABC Hospital, but you do business as all these clinic names, your legal name is ABC Hospital. Your tax ID number has to go here and your address. Again, your zip postal code is your 9-digit zip code. Make sure that matches. I've literally had grants done and not been able to submit in the final hour because somehow there's a mess up at the postal service with they moved suites and the 4-digit zip code, the last 4 digits of their zip code didn't get changed somehow. So make sure you're on top of that. Person to be contacted on matters involving this application, that's usually your project director, but it does not have to be. Fill in that information. Make sure it's a telephone. Don't put an office number if they never ever check their office voicemail. So make sure it's a number that somebody checks and somebody will answer. Type of applicant, that's whether you're nonprofit, for-profit. The federal agency probably will fill in itself, but when you download it, I don't think it does that. But again, that would be HRSA. The opportunity number and the title is the RHC Vax Confidence. Ignore the ones that aren't highlighted, and the descriptive title is any title that you want. A lot of times if you've submitted grants in the past, this is where you attach the abstract. That's not the case on this grant. There is a separate abstract form. So please note that. That is a difference. 90% of the HRSA grants I submit, or FQHC lookalike applications, this is where you put the abstract, not on this particular application. Congressional districts. So you can always look up your congressional district if you don't know it, but it is tricky. So for me, I live in IN-008. If I just put in IN-8, it will come up with an error. So this is where the applicant's located and then where the program project is located. So this is relevant. You may be in separate congressional districts. The big hospital may be in one district and then in a city, and the rural projects might be somewhere else. If there's not enough space and you're in more congressional districts, you need to add a sheet, just do a Word document and list them. And again, it may be that you're in Tennessee, TN-001. The proposed dates, we know, July 1, 2021, 6/30/2022. This is where you put your federal funding. The rest of these should be 0. So again, 50,000 per site. You will have to look this up. You can Google it. Most states are not under the review, and most people will mark C as it's not covered, but you will need to check that for your individual state. Some states do make you submit grants on their state portal so they know that you applied. Make sure you're not delinquent on any federal debt. You have to agree, and this is where this has to be your project director, the person with the authority. So if that's the big CEO of the big conglomerate, that's who goes on this, or whoever is your actual project director. So I think that should cover most all of the questions that we were working on. So I think now I can just answer questions.
Okay, well, that was fantastic. I think everybody's going to feel a little bit better about putting this grant application together, because, like I said, most of these people have never done one before, and so not a clue on how to get started. So I would feel pretty good about at least knowing what direction to go in. We do have some questions here. We got one in the chat. So let's start off with that one, and then we'll work our way down through the ones that are in the questions pane there. Can the grant be used as an incentive for patients to be vaccinated? So,
well, this is where exactly I would pull up. I would look at the activities, so which starts on page 18 of your NOFO that came from HRSA. Looks just like this. All of you, I think, have probably received about 15 copies of it, because I know I have. And I would look and see if that's one of the things that they can do. I am not seeing that as something that they can do, and there are some rules around that. So you can do ads, you can do meetings to engage stakeholders, you can publish articles and use funding for that, pay for somebody to do presentations at PTAs or VFWs. It does say you can set up a ride scheduling service for them or a home visiting resource card to vaccinate people. And it talks about listening and communication sessions, but I don't think that, I would not feel comfortable telling you that that you can just spend it on giving people, t-shirts or balloons or something. Now, this is an opportunity, and grants also encourage partnerships. So, think about that and say, hey, I could get this federal grant, and I could have do extra listening sessions, and maybe get another local community partner to say, hey, if I do that, would you be willing to sponsor free snacks? If I do that, would you be willing to do a door prize? Those types of things. So always look to use grants to create partnerships. Go to your local health departments, local community foundations, any local organizations you have. Walmart, every Walmart in the country can give up to $5,000 for items. When you go and request it, if you're a nonprofit organization, so that may exclude my for-profit RHCs, but for the nonprofit RHCs, go to Walmart and ask them then to give, incentives. Whatever you think is appropriate. But I don't think I would. I'm not going to say it's against the rules, but I would just, again, follow these exact activities.
yeah, Elizabeth, I know in Tennessee, during vaccination time, a lot of our MCOs have a really good package for incentives for their mothers to bring their children in and things. They'll give them like backpacks, and I mean, some of them give like Game Boys and stuff like that. So maybe this is an opportunity to reach out to those MCOs and say, hey, we need to get these kids with COVID that are old enough to get their COVID shots. Can we partner with you? You can give them the backpack and we can give them the shot, something like that.
Right. And we even use like our local Optimists, Lions clubs. When I ran clinics, we did a lot of things like that to say, hey, would you be willing to donate? We'll do a big grill out party and we'll get kids vaccinated or anything like that. So you can do incentives that way. And I do know too, people a lot of times are willing to pay for t-shirts. I've talked to a couple of my clients recently that are giving, I got vaccinated t-shirts. So that's in my mind, but put their logo on it at the bottom or something like that. So, there's a lot of ways to think about it, but I would really stick to the work plan. I do know with SAMHSA grants, you can give patient incentives, and those are examples provided as being allowable. And I'm not seeing that in this example of HRSA. Again, I'm not going to say it's against the rules because I'm not HRSA. I don't speak for them. But if you were my client, I would definitely advise you to stick to the work plan table.
Okay.
Thank you.
A lot of the questions are about getting the slides. We're going to put the slides up on the Facebook group, and we're going to put all the slides are already on our ruralhealthclinic.com at COVID-19. So the slides will be available. I'm sorry that GoToWebinars did not cooperate on that, but that's where they are. Next question is, I have started an application and need an applicant identifier and federal identifier. No one has been able to provide this to me, and the state identifier. This is a question from Dustin. Elizabeth, do you know what Dustin is talking about as far as those application identifier or federal identifier?
Yeah, so I believe he is actually talking about he or she, I'm sorry.
It's a he. It's a he.
It's a he. Okay, good. I believe what you're talking about are these where it says applicant identifier. It's on the SF 424, the main one, federal entity identifier and federal award identifier. You should not have those, and those are not required sections. So I would leave them blank. And it should not, once you're done and you click the check for errors button on grants.gov, that should not cause an error. If it does, you need to call grants.gov because that's a problem. That's not a highlighted and it's not a required section. You should not have it. Once you receive the grant on the notice of award, they will then give you an applicant identifier, a federal entity identifier, and a federal award identifier for this grant. So I have never submitted a grant with those ever unless you are like an existing FQHC or an existing Ryan White HIV site type thing where you get this grant every 3 years, you may have those. Otherwise, for RHCs that have never received a grant award, you should not have them. You should leave them blank. And it's definitely, if there is an error, it may be because in number 2, you don't have new marked. So I would make sure to click new, and then it should skip you right down to your legal name.
Okay. Elizabeth, do you mind sharing these? I take it the stuff that's in yellow, those are the ones that we have to fill out as RHCs. Is that correct?
That's correct. And I got this off grants.gov, but I can share it with you, Mark, and you can post it to the Facebook page. I'll email it to you right after this presentation.
That would be great. I think that would really help people to because they're going to be like me. A lot of times they're not going to be able to find it. And I know whenever I go into some of these websites, what is the one that FEMA's put up there? As for Tracy, it's like a black hole. You can't find anything that you're looking for because
I know.
And
I will tell you, grants.gov, I will tell you it's not the most user friendly. I don't think it claims to be user friendly. I will tell you, I hired an assistant this year, and she said it almost seems like grants.gov wants to stop people from applying for grants. I didn't say that, and I'm not saying that because I think we've got to use it. It's a system we have, but in some ways it does seem to prohibit people or to confuse people. So please don't let it be confused. But again, make sure you mark application in number 1 and new in number 2, and it should skip you right down to the next highlighted section. But yeah, we'll provide these for you. And again, you can always email me if you have questions as well. And I will just put in a plug right here since Mark plugged at the beginning. If you really don't want to deal with any of this, you can just hire me to do this for you. And I do all the forms and the writing of it for you after you tell me what you want to spend your money on. So feel free for that. Thanks, Mark. That was my shameless plug. Okay.
Yeah, no, you plug away, girl, because our folks need you. I mean, I've been working in this space for 35 years, and I know what our people can and cannot do, and you're going to need help doing this, people. I mean, you've got enough on your plate already taking care of everybody, as far as COVID goes, to learn how to do this grant application and all these numbers and all these different acronyms that none of us are familiar with. And have this all done by June 23rd, the learning curve is going to be too steep for the amount of time it takes to get this done. So spend some money. It'll be the best money you ever spent, and get it in sort of stress-free, because we got enough stress already. So let's go on to the next question here. When working in grants.gov, can you leave it and then go back?
Yes. So as long as you have your workspace open, you can leave it. I always suggest unlocking forms, because if there are 2 of you working on it, if a form's locked, even if the other person has access, they cannot do it. It will be locked under your name. So it would say locked by Mark Lynn. And even though I would have access to the same application, it would not let Elizabeth Burrows in. So just be aware of that. I always say to unlock the forms, but yes, you can work on it. If you save, make sure you do click save often. And I will give you a hint. This is probably the best advice you'll receive all day, and you'll never find it on a slide. But this is me, but I'm on rural internet, so that could be the problem. But I will tell you, I have a lot of problems when I'm working on it during, Eastern and Central time, daytime. So, 8 to 6 or whatever it is, Eastern, Central, whatever, where most people are on grants.gov. If I go working on it at night, it works much faster and much better and does not kick me out enough. a lot. But I will warn you, grants.gov can and will kick you out at some point, and just smile and grin and bear it. It is not the most friendly system. If you're used to HRSA electronic handbooks, that is much better. Grants.gov is extremely kind of touchy, to be honest. So just know that, but work on it at night or on the weekends, and it will be more friendly to you. That's probably, again, the best advice I'm giving to you all day.
Okay. Okay. Is it necessary to have a cage number? CAGE capital? I don't know what a cage number is. So
you have to have your SAM, you have to have your DUNS, your SAM, and your CCR. You have to be registered through all of those. And again, HRSA goes through it in detail, and so did the National Association of Rural Health Clinics. And I'm sure Mark has those on his website as well, their presentation, so you can watch those. I think usually you have a cage number if you have SAM, and they're doing a transition, so I think they oftentimes are one and the same. I don't think they actually say a cage number is required, but to my knowledge, if you have all the others, you end up having a cage. But I think on the National Association of Rural Health Clinics and on HRSA, they did not say you had to have a cage number.
Okay.
So
this is a very similar question. I read that an organization does not have to be registered in SAM, but this is being waived for this particular grant prior to submitting the application. We've been having difficulty getting registered, and I'm concerned that it will not be finished by the time we need to apply for this. Is this correct? And if so, how does someone submit an application when they're not registered in grants.gov?
Okay, so what I would do if I were you is and this is exactly what I've told a couple of people I'm working with on this, make sure SAM is your top priority. Start with SAM and work through that as best you can. And I will tell you, their helplines are helpful. I know you may sit there and listen to some annoying music for a while, but their helplines are helpful. If you need me to help you work on this, you can reach out and email me. But I will tell you, get through your SAM. You must have your items. You have to have your tax ID number. You have to have your DUNS number connected with the correct address, as I've just learned through experience this time. And you have to have your bank account information. SAM is getting back with people within the 2 days. I'm hearing that over and over. If they don't get back with you, because this happened with one of my FQHC clients a few months back, bug them, because it did fall through the cracks of the system. So if you don't hear back in the 48 hours, you can then bother them or call the help desk. I don't know, that would have to be a HRSA question about if they're going to give you an exception to the rule. What I heard Natalie say yesterday was you had to be registered. If you think you're already having problems, I would hurry up and email the RHC vaxconfidence@hrsa.gov. Myself, I would send them an email and check on that and make sure you have documentation. Keep every email they provide you. And I have only seen them give waivers a couple of times before. They did it with the FQHC lookalike grant in 2019, and they did give 2 waivers to clients that did request them, but it was in the final hour, and it was for very good reasons, and it was because they were upgrading the SAM system that year. To my knowledge, they're not upgrading the system, so I would, if I were you, make SAM a top priority and just have to dig in and get through it. If you can't do it, designate it to somebody else or find a consultant or someone who knows what they're doing to do it for you, because I would hate for you to lose out on $50 or $100 or $150,000 over SAM. Again, as they said yesterday, make sure you go to sam.gov. Don't pay money. I've already had a couple people pay. There's a lot of websites that try to take your money to get your SAM, and that is not right.
Okay. We'll go through. We'll end on the hour, so we've got a few more minutes here. If you've got time, Elizabeth, to hang with us for 12 more minutes. When using computers and such for the grant, how do you justify that is not equipment, or what would you describe as equipment?
Okay, equipment, this is the definition of equipment, and it even says it in the link to the NOFO. I checked it just to make sure, because I didn't want to say the wrong thing on this presentation. Equipment is when one item costs more than $5,000. So don't think of the item, it is simply a dollar amount. So you may think of a computer as equipment. Most computers do not cost $5,000. So make sure that you consider not equipment. So again, equipment is when one item costs more than $5,000. So again, if you're, let's say your invoice, let's say you're ordering new iPads, and you're gonna, because you're gonna do education on them, and you're gonna do telehealth, and you're gonna give them to the schools to do vaccine outreach with all kinds of iPads, and you're like, but I'm ordering 10 and it's gonna cost, or I'm ordering 11, it's gonna cost me $5,500. That's fine, because each individual iPad did not cost over $5,000. So again, my suggestion to you would be to count it, it's a supply, iPads, computers, otoscopes, anything that you need, you know, PPE equipment, anything like that would be under your $5,000, and that would be considered supplies.
Okay.
A piece of equipment that would have to cost more would be some really expensive, you know, an ultrasound machine, which wouldn't even be an allowable thing on this. I can't think of something allowable that would be for this, so that would cost you.
Okay. Can you define indirect cost, and then why wouldn't you ask for indirect cost is the question.
Okay. So I understand what you're wanting with indirect costs, because of course we have to pay for our desk and our workspace and our overhead. You need to have it defined. So to get an indirect cost rate, you have to apply for that with HRSA, and you have to have it approved. If it's not approved, then they can, oftentimes they don't approve them, and then it just gets taken off your grant. So you could risk losing, say, 10% of your grant because you want it to be indirect. So what I would do is, to help cover that, is maybe you pay in your supplies, you pay for some printing, you pay for paper, you pay for whatever you're going to be needing for the vaccine outreach, or you pay for staff time. But I would not pay for indirect rates unless your organization has an approved indirect cost rate. Otherwise, you're risking having your grant reduced.
Okay. What about a digital sign? Would that be considered equipment?
It would depend on the cost. So if your digital sign is, again, $4,999,
you're good.
you're good. If it's over 5,000, you're not good. It's funny with digital signs. I will tell you, my digital sign, make sure you know how to control it, because those things have a mind of their own. I can tell you story after story with the digital sign. So, but you know, if you can get that done, or again, just think too, if you say, well, I'm just so upset, I really wanted a digital sign, it's going to be $20,000, and that lady Elizabeth told me not to do it. You know, think again, if you're going to be able to afford to pay staff or pay your MAs to do the vaccines, then that frees up other money from your general RHC budget to be able to pay for something else. So always think about that. Or again, you know, your vendors understand grants, and you say, hey, I can buy this, but it has to be $4,800. Sometimes they will cut you a deal.
Okay. Can you go into detail on construction being a use of funds, the conditions on that?
No, you can't do construction. This is not a construction grant. You cannot do it. Don't do it.
No, don't do it. It's not worth it.
Do not do it. I'm just telling you, I could speak all day on it, but if you have specific construction needs and you are in a rural area, there is money I've been hearing coming out through USDA. Feel free to reach out to me so I can let you know when that does become available. It has been passed. It is in the budget. I don't think it has been announced yet, but it is coming out through, I believe, USDA Rural Development. I've also heard it might come out through a couple other economic national organizations. So, but there is money out there specifically for rural health clinics for that, for construction. I have not seen it. It's not announced yet. So don't go looking for it yet. It's not announced yet. It's just been passed in the budget. But please do not write anything for construction on this grant.
Okay. Let me see here. There was a good one in there, and I went right past it. Let's see here. Where was it?
I'm just going to tell you, your biggest cost is staff. Pay staff. That's your cleanest, best way to spend money. I'm just throwing that out.
Okay. Let's see here. You stress. Okay, and here we go. You stressed using the HRSA work plan. Are you aware of any other activities that clinics are considering? I think what you've said is stick to the work plan, the 3 or 4 examples for the most part.
Yeah, I mean, I've had, and this goes with social media, I've had people looking at Facebook ads, buying Facebook, you know, social, what is it, optimization, so it pops up to the right people. As a side note, there are grants to help you on that too. If you want to get connected with that, Google offers grants, and for nonprofits, will pay 90% to help you get Facebook ads and stuff for certain things. Keep that in mind. I've seen people doing billboards. Again, that would be a contractual cost. That's not an equipment cost. Mostly, I've just seen people trying to make sure that they have their healthcare providers available to start doing outreach activities and those types of things. So again, your staff are an allowable cost. So that's, again, how I think a lot of people are doing it. I know a lot of people too are trying to work and partner with schools on this. And I think that would be smart because, again, that's going to be, as Mark said, at least in my area, anybody that's wanted a vaccine has them. You can't give them away at this point. So, you know, just thinking of ways to get those target audiences. I also know some people are doing like campaigns with certain factory going into like big workplaces and stuff and doing things there. And maybe then that organization helps incentivize those patients / employees to get the vaccine. And I thought that was a really creative, cool idea.
Okay. This one is pretty detailed, so let's go in and this could be very helpful to this person here. On section B, budget categories, do we fill in 11 and 2 if we have 2 RHCs doing different projects? So.
Okay, so you are only going to fill in, I think this is, are they talking about this question? I'm not for sure which form they're talking about, but keep in mind the way that HRSA has been explaining this. And again, this is different for me too, the way they're doing the per site amount, but they want one application. This is different than what I've seen in the past as well. And again, I've been working in the grant field for over 20 years. So this is new to me, but the way I understand it, it's still one budget. So even if your 2 RHCs are doing 2 different things, that would show on your work plan they're doing 2 different things, but it's still one budget. So all they care about is how you're spending $100,000 in the one way. So if it's personnel at one site and it's supplies at the other, that's fine. You don't differentiate. It still is done in one budget. And you also have to do your budget narrative. That has to match. And that is where you further explain that. And that's where you go into those details about exactly how you're, you know, for your fringe benefits, what's your percent, what does that include? They're being very basic in the example, and I would be very basic as well.
Okay, I think we probably ought to sort of cut off on the detailed questions at this point, just give some general things. One of the questions was, can we share this? Yes, it's being recorded. It will go on our YouTube channel. Like all these are free, so you don't have to. Make sure you share this information with as many people as possible, especially those people that are working on your grants. And then another question is Ms. Burrows accepting new clients for this grant? And so I'll let you give one more plug before we go on how to get a hold of you. I will post Elizabeth's information on how to get a hold of her on the group and on our website as well, because I know you people are going to need to get a hold of her very quickly, because this has got to move in order for us to meet that June 23rd deadline. So I'll leave the ending up to you, Elizabeth.
Yeah, thank you. Feel free to reach out. I'm always available for any grant writing, including this grant and any other future grants. And I also do a lot of federally qualified health center and federally qualified health center lookalike applications. And I also assist people with the 340B drug program, specifically in helping them maximize just revenue for outpatient clinics. So those are kind of my services. I would love to work with you. I've managed rural health clinics. I've been a CEO of an FQHC and an FQHC lookalike, so I've been in the weeds, and I have learned what I really like, which is building programs and building grants. So feel free to reach out anytime. Sorry I don't have a better online presence, but again, I am working on that. And if you don't hear from me within 24 hours, by email or text, bug me again. You will not offend me. I think I'm responsive, and Mark can attest to that, but feel free to always reach out again. Thank you again for your time, and I appreciate all that you do to help rural health throughout America.
Yeah, thank you, Elizabeth. This has been great. This is exactly what I think everybody needed. And I can attest, Elizabeth is extremely responsive. I thought I was the only one working 12 hours a day, 7 days a week, but I do believe I have a hard time keeping up with her. So all right. Well, thank you, everybody. Thank you for what you are doing. Get to working on this, and we will see you guys very soon and have this recording available for you. So thank you.
Thank you.
Bye-bye.